The history of inhumane mental health treatments. Mental health treatment today is no walk in the park, from insurance companies denying coverage, to a lasting stigma, to the fact that many of the most severely mentally ill among us to their own devices on the streets or relegated to prison. It's an understatement to say that there is work left to be done. Yet the inhumane history of mental health treatment reminds us how far we have already come. Asylums. While terrifying mental health remedies can be traced back to prehistoric times, it's the dawn of the Asylum Era in the mid-1700s that makes a period of some of the most inhumane mental health treatments. This is when asylums themselves became notorious warehouses for the mentally ill. The purpose of the earliest mental institutions was neither treatment nor cure, but rather the enforced segregation of inmates from society. The mentally ill were considered social deviants, or moral misfits, suffering divine punishment for some inexcusable transgression. Hydrotherapy. Proved to be a popular technique, warm, or more commonly cold water, allegedly reduced agitation, particularly for those experiencing manic episodes. People were either submerged in a bath for hours at a time, mummified in Rat Pack, or sprayed with the deluge of shockingly cold water in showers. Asylums also relied heavily on mechanical restraints, using straitjackets, manacles, waistcoats, and leather wristlets, sometimes for hours or days at a time. Doctors claimed restraints kept patients safe, but as asylums filled up, the use of physical restraint was more as a means of controlling overcrowded institutions. At the same time, asylums were on the rise. So too was psychiatry, a fledgling wing of the medical profession bent on proving their ability to treat as opposed to simply manage the ill. Asylums served as the perfect lab for psychiatric treatments. Early psychiatric treatments. Though Benjamin Rush, considered the father of American psychiatry, was first to abandon the theory that demon possession caused insanity, this didn't stop him from using old humoral treatments on asylum patients to cure their minds. Instead of letting out demons as the treatment was originally intended, he thought the body's fluids were out of balance. As such, he purged, blistered, vomited, and bled his patients. Similarly, Henry Cotton, superintendent at New Jersey Trenton State Hospital from 1907 to 1930, thought infected parts of the body led to mental illness. He focused on pulling rotting teeth, which he thought caused madness, inducing infections. When that didn't work, presumably because contaminated saliva still made its way into the body, Cotton began removing tonsils as well. And then he took it a step farther, removing parts of stomachs, small intestines, appendixes, gallbladder, thyroid glands, and particularly parts of the colon, any place where it was thought infection could linger. Unsurprisingly, this did not prove to be a reliable cure, and it carried a high mortality rate. Inspired by the discovery that high fevers help stop the symptoms of advanced syphilis, Julius Wagner Jurog experimented with inducing fevers in people with schizophrenia by injecting them with malaria-infected blood. This popular method even earned Wagner Jurog the 1927 Nobel Prize. in physiology or medicine, the first ever awarded for the field of psychiatry. Like Cotton's body part removal technique before it, malaria-induced fevers had a high mortality rate as well. About 15% of patients treated with Wagner-Chirurg's fever cure died from the procedure. Shock therapies. By then, however, the professional community was ready to move on to the next fad, insulin shock therapy. Brought to the United States by Manfred Sackel, a German neurologist, insulin shock therapy injected high levels of insulin into patients to cause convulsions and a coma. After several hours, the living dead would be revived from the coma and thought cured of their madness. This process would be repeated daily for months at a time, with doctors sometimes administering as many as 50 to 60 treatments per patient. According to Lieberman, however, the procedure was obviously risky and caused amnesia. Nevertheless, the treatment proved popular based on a questionable success rate. By 1941, according to U.S. Public Health Survey, 72% of the country's 305 reporting public and private asylums were using insulin coma therapy, not only for schizophrenia but also for other types of madness. Another shock therapy was yet to come, Metrazol shock therapy. Like insulin, worked on the mistaken premise that epilepsy and schizophrenia couldn't exist at the same time. The key? Seizures. Laszlo von Menduna, a Hungarian physician, discovered that the drug Metrazol could produce seizure-like convulsions in patients, therefore locking their brains out of mental illness. It proved to be a shock physically as well. Metrazol also provoked thrashing convulsions so violent they could become quite literally back-breaking, writes Lieberman. In 1939, an X-ray study at the New York State Psychiatric Institute found that 43% of patients who underwent Metrazol convulsion therapy experienced fractures in their vertebrae. You get blown up and you go unconscious, like something boils up, described one patient of treatment. I felt like every time I took that as if I was going to die. Beyond its terrifying experience, Metrazol shock therapy also produced retrograde amnesia. Luckily, the Federal Drug Administration revoked Metrazol's approval in 1982. And this method of treatment for schizophrenia and depression disappeared in the 1950s, thanks to electroconvulsive shock therapy. Electroconvulsive shock therapy. Buzzbox, Shock Factory, Power Cocktail, Stun Shop, the penicillin of psychiatry. One of the most infamous treatments for mental illness includes electroconvulsive shock therapy. Types of non-convulsive shock therapy can be traced back as early as the 1st century AD, when according to D. Young, the malaise of headaches and of the Roman Emperor Claudius were treated by the application of a torpedo fish, better known as an electric ray, on his forehead, but their hydra in treating mental illness began in 1938. ECT carried less risk of fracture than Metrazol shock therapy, and with the use of anesthetics and muscle relaxers in later years, the fracture rate became negligible. It wasn't without side effects. However, including amnesia as well as increased suicidal tendencies, Ernest Hemingway, for example, died by suicide shortly after an ECT treatment. ECT was a welcome replacement for Metrazol therapy, writes Lieberman. Depressed patients in particular often showed dramatic improvements in mood just after a few sessions. And while there were still some side effects to ECT, they were nothing compared to the daunting risks of coma therapy, malaria therapy, or lobotomies. It was truly a miracle treatment. Lobotomies. Around the same time, doctors overseas performed the first lobotomies. The practice was brought to the United States thanks to Walter Freeman, who began experimenting with lobotomies in the 1940s, which required damaging neural connections in the prefrontal cortex area of the brain, thought to cause mental illness. The behaviors doctors were trying to fix, they thought were set down in neurological connections. Baron Lerner, a medical historian and professor at NYU Langone Medical Center in New York, told Live Science, the idea was, if you could damage those connections, you could stop the bad behaviors. The problem was, lobotomies didn't just stop bad behaviors, they damaged people's memories and personalities, which even Freeman admitted, every patient probably loses something by this operation. Some spontaneity, some sparkle, some flavor of the personality. According to D. Young, despite the side effects, by the time Freeman died in 1972, approximately 50,000 lobotomies had been performed on U.S. patients, mostly in asylums. However, less than 350 lobotomies were performed by the year in 1970s. By then, medication dominated mental health treatment. Psychiatric medications. Drugs had been used in treating the mentally ill as far back as the mid-1800s. Their purpose then was to sedate patients to keep overcrowded asylums more manageable, a kind of chemical restraint to replace the physical restraints of earlier years. Doctors administered drugs such as opium and morphine, both of which carried side effects and the risk of addiction. Toxic mercury was used to control mania. Barbiturates put patients into a deep sleep thought to improve their madness. Chloral hydrate came of use in the 1950s, but like the drugs before it, it had side effects, including psychotic episodes. And then came Thorazine, the medical breakthrough psychiatrists had seemingly been searching for all these years. While it wasn't perfect, it proved much safer and effective at treating several mental illness. Its use, along with other drugs that quickly followed, such as Risperdal, Zyprexa, Abilify, and Seroquel, marked the beginning of a sea change of mental illness for mental health patients. In 1955, the year for the first effective antipsychotic drug was introduced. There were more than 500,000 patients in asylums. By 1994, that number decreased to just over 70,000. Starting in the 1960s, institutions were gradually closed and the care of mental illness was transferred largely to independent community care centers, as treatments became both more sophisticated and humane. While these changes in modern care come with their own challenges, the treatment of mental health has come a long way in 250 years. No longer do the mentally ill need to fear living in inhumane asylums for life, being subjected to experimental shock treatments, or undergoing dangerous surgeries without consent. Mental health treatment may still come with a stigma, but there's a lot of hope for the future. Join me in exploring with Angelo as we explore one of the most haunted insane asylums in all of Canada. We'll be using all of the equipment that we have available to us. So be sure to hit that like button, smash subscribe, because we have a lot more to come.
How are you feeling?
Fine.
Nervous?
Mm-hmm.
I think it's understandable. How long have you been here in the hospital?
3 days.
What brought you here?
I ran away from Camarillo State Hospital. I was still sick, so I came back to
You came back here by yourself?
Yes.
Why did you come here?
Because this is the only place I knew to come to for help.
For help with what?
With my problems.
Can you tell us what they are?
Just an inability to get along with people and my family, and I can't take care of myself.
Mm.